One question I hear often is, if there is so much bad medical information online, why don't more doctors make videos? And honestly, it's a really fair question, because there are actually a lot of reasons physicians hesitate to create content online. Most doctors spend years learning how to diagnose disease, interpret research, manage risk, and care for patients. But here's the thing, almost none of us were trained to communicate through social media. Creating educational videos is a completely different skill set. You have to simplify complex information, keep people engaged, write scripts, edit videos, make thumbnails, and explain complicated topics clearly without overly simplifying them. You have to do all of this while making sure you're covering all the what-if scenarios. That's not something medical school or residency really prepares doctors for. The problem is that medicine is individualized. What I tell my next patient may be the complete opposite of what I told my last patient. A symptom that's harmless to one person could be very serious to another. So many doctors worry about being misquoted, oversimplifying medical advice, or having someone misunderstand information outside of the exam. And honestly, those concerns are valid. A YouTube video can educate people, but it can't replace an actual medical evaluation. Another big factor is simply time. Most doctors are already working full schedules, seeing patients, handling paperwork, reviewing charts, and staying current with continuing education and research. And making videos takes a surprising amount of work. Even a short 4-minute video like this involves planning, scripting, filming, editing, thumbnails, comments, and revisions. And many healthcare professionals are already dealing with burnout. So content creation often feels impossible to add on top of everything else. But I do think more physicians are slowly starting to go online. I personally tried 4 years ago, and then my world just got too busy, so I stopped. But here's the thing, the world is having a hard time trusting doctors right now, and I understand why. But I want to be a source to help bring that trust back, because whether doctors like it or not, patients are already getting medical information from the internet, and that's not changing. So I think there's real value in having more evidence-based voices online, helping people better understand their health, not to replace medical care, but to help people, help them ask better questions, recognize important systems, understand treatment options, and feel less overwhelmed. So my goal with this channel is not to scare people or pretend like the internet can replace an eye exam. It's simply to make eye health information easier to understand. So if you enjoy practical, evidence-based eye health education without all the fear and hype, subscribe, because I post new videos every week